we're going to do an overview. What is influenza? What is H1N1 influenza? How does that impact us individually, collectively as a community? Why are we talking about it? Why is everybody, so excited about particularly H1N1 and getting vaccinated? What's new about that? What is the potential impact of it? And then just engage in sort of a back and forth discussion about, what is the vaccine? Is the vaccine safe? Do I get treated if I have it? What do I do? And kind of those sorts of things. So we'll take a look at that. So why are we talking about it? And what you may or may not have started to see or read about, heard, we talk about it because influenza is something that is very contagious and it gets into a community, and as you see, probably from watching the news, it spreads easily. So this is something that's going on now. It's widely prevalent in our community here. We're seeing a fair amount of it, and it's going to be here. It's going to be here for a few weeks. It's going to be here for months, and how good of a job we do with some of the other things will dictate the impact that it has. But it's important because it's not something that's going to be here one day and gone the next. Pandemics, which the World Health Organization has declared this, can affect disproportionately some younger people. It affects businesses' incomes. It affects obviously we're all sort of, as we're finding out, interrelated as far as healthcare, insurance payments, expenses, things like that. So it affects everybody. There's a lot of potential for sickness and death and disruption of economics and just how we do things. You can look at even schools. Some schools, a lot of schools are more than 10% of their student population out with influenza right now. So it's obviously prevalent and important. A little bit about the economic impact. It's a lot of money that's generally lost. And what we'll get to in a minute, we'll show a map kind of where is, right now, the main, the influenza that's present is almost entirely presumed to be H1N1. And if I'm wrong, but that's the last that I checked. It's affecting across the country, and we'll show a map about that in a second here. So I don't remember any of these. I wasn't around then, but I don't know if anybody else does, perhaps. Past influenza pandemics, 1918, H1N1, Spanish flu, iron lungs, and lots of other stuff that we read about in medical textbooks. But 20 to 40 million people died, 675,000 in the United States. Compare that to an average influenza year. I think about 200,000 people generally get hospitalized in the United States on an annual basis from influenza-related complications, and somewhere in the neighborhood of 30,000-ish deaths. 1957, Asian flu, H1N1, 1 to 4 million deaths, 70,000 in the United States, and then in 1968, different variety, similar but fewer U.S. deaths at that time. So what is required? So a pandemic, very widespread. This isn't local, it's not regional, it's everywhere. This is across the globe. You have to have a novel or a new virus to which the population has little or no immunity. So one of the ideas, why is this different so much than a regular influenza season? And the reason is primarily that we're not immune. There's this idea in public health and epidemiology of what we call herd immunity, meaning that if half of us were immune in this room and half of us weren't, the transmission stops at some point. The transmission is, person to person. It's droplet. It's from what you cough, what you sneeze. Flu doesn't live on inanimate objects that long. Lives on inanimate objects about a couple of hours probably. So, when you touch things. But at some point, during the season, if everybody was immune, everybody was vaccinated, the transmission stops. Right now, since basically nobody is immune, or very few are immune at the start of this, everybody's susceptible, so the transmission is much higher. It's much easier for the virus to spread throughout the community because there's no stopping point, unless now people who have already been infected. So that's why it lasts for weeks to months, and this is why pandemics occur as the flu virus mutates and changes. Obviously it's pathogenic, and then what we just talked about, I guess. Basically, if you want to get away from it, what I got out of this one was go to D.C. because it was deemed local, at least at that point. But pretty much it's widespread. All of the country is basically affected on a regional and widespread basis. So a word about H1N1, referred to as swine flu. Now, you don't get it from pigs. You don't get it from eating meat or pork or anything like that. But basically what it is the genetics, sort of the DNA or so to speak, of the virus is part human and part swine related. Spreading from person to person, obviously there's been much ado about the virus, and the government's been really taking a prominent role in propagating forward, working with vaccine and getting things out there. Because again, there is a huge economic impact to the government, to our economy, through this. And then again, the World Health Organization declared a pandemic. I think that was back in the spring or a while ago. Okay, so most cases of H1N1 influenza, it kind of looks and smells and acts a lot like regular influenza, and we'll get to some of those symptoms here in a second. A lot of cases are mild. Not everybody who gets H1N1 influenza gets admitted to the hospital. Not everybody gets pneumonia or has other complications. The incubation period, meaning the time from which you are exposed to the virus and you basically have virus in your body, to the time in which you produce symptoms, is generally between 1 to 4 days. Sometimes up to 7, but most commonly, meaning that if you are exposed to somebody and you make it sort of 4 days out, maybe you're in the clear, maybe you're not. One of the things that's difficult about this is that patients will actually shed virus for 24 hours, up 24 hours-ish before they ever show symptoms. So you could be, with somebody and they're perfectly fine, but they can actually give you the virus because they don't have symptoms, but they can still infect you, which again is part of the whole transmission thing and why this propagates itself forward. Typically, the virus, then you can shed virus. Sometimes in younger people, it's a little bit longer. We're talking 7-10 days. Typically after the fever associated with influenza is gone or their cough is decreased, it's a weakened virus at that point that they're shedding, so it's maybe not quite as infectious as it was to begin, but they still can shed and infect up to 7 to 10 days afterwards. So again, you don't get it from eating pork. All right, so one of the great mysteries to me is I think sometimes we think of flu and we think of stomach flu, which is basically completely different. The stomach flu is what a lot of people get every year, the nausea, the vomiting, the diarrhea. What influenza is, again, it's a respiratory illness. So influenza is primarily characterized by high-grade fever, cough, body aches. The most common thing that patients say to me when they come into the office is, I want to know where the truck is that hit me when this all started. So some people have headache. There's some vomiting, there's some diarrhea associated with H1N1, which is a little bit different. Again, we're learning more about the virus as it's more prevalent. It's a little bit more than seasonal flu, but it would not be the prominent finding. So somebody who has very prominent nausea and lots of vomiting and lots of diarrhea and doesn't really have a cough and doesn't really have any respiratory symptoms, probably, again, you want to talk to your doctor about it, but probably is not due to influenza itself. So the influenza vaccine does not protect you from the nausea, vomiting, and diarrhea bugs that routinely make their way through the community. But basically, it just, people feel bad, achy, lots of fever. How soon can you become sick? Again, 1 to 4 days after you catch the virus. Typically, influenza has a tendency to 1 hour I'm fine, the next hour I'm sick. A lot of patients will say that, I made it, I was feeling fine up until now, and boom, I just felt achy all over, I was chilled, I started coughing. It doesn't always happen that way, but a lot of times patients feel like it's a pretty acute onset. It's a little bit different than from what you would consider the normal, your upper respiratory infections, your bronchitis, where, I kind of woke up one day and I kind of had a sore throat, but I didn't feel too bad. And I went along and I maybe had a little bit of a cough and I had a little bit of an earache, and then, that sort of progression. That typically will not be influenza. It's, again, nothing's 100%, but talk to your doctor about it. But that's sort of not the usual progression with how influenza works. Personal protection. How can you protect yourself? The best thing is if you touch something out in public, it's washing your hands. It's if you are around somebody who has influenza in your house or, at your work who you find out, the best thing is don't touch your mouth, don't touch your eyes, and just keep your hands, free and clear. Again, this is a droplet. So somebody, don't cough on your neighbor. If your neighbors cough, wash your hands before you eat. Make sure you're doing that. Make sure you're in a clean environment. And don't rub your eye. don't lick your finger to get through the paper and do those sorts of things, because again, that's going to increase your risk for transmission. If you are sick, if you are diagnosed with influenza, if somebody, again, the best thing is stay home. So we all have to work together on this as a community to make sure that this doesn't spread more. If you think you might have it, again, talk to your doctor. If you're working, employers should be more than willing to accommodate you because they don't want you to put the rest of the workforce out. But generally, the recommendation is no fever for over 24 hours, and that's no fever without Tylenol, without ibuprofen, without something else that's bringing the fever down. And you want a significant improvement in your symptoms as far as cough, body aches, and that sort of thing. So it may be 7 days, but you kind of have to, again, talk with your doctor. But generally, you want to be feeling quite a bit better with no fever before you're going back and getting out with people. Likewise, if you have it and you have a grandchild or a niece or a nephew or somebody who's young, or you're around somebody who's pregnant or is getting, medicines for chemotherapy or, some sort of cancer or something, stay away. It can be hard, but it's better to, protect them and, prevent the spread. So the biggest thing, again, it's really hard, but don't touch your mouth, don't touch your eyes. All right, so a little bit about the vaccine, and Stephanie's probably a lot more up to date on this than I am, but the government is purchasing the vaccine. The vaccine is, you may have read, from what I've read, it's coming a little bit slower than they would like, but the H1N1 vaccine is coming out now. There is also right now a shortage of seasonal flu vaccine, and that's because the manufacturers are having a hard time producing both at the same time. So I know that there's a problem in our organization, and I think city, county-wide, and I think probably nationwide, in getting seasonal flu vaccine out. So if you've not gotten your seasonal flu vaccine, the good news is there's not really seasonal flu out there right now. When I say seasonal flu, I mean the usual influenza virus that's out. But do be looking for that, trying to get that. As far as H1N1 vaccine, I think we're going to have a slide about the groups of which are being recommended more strictly to get it, and then the priority, because as it comes available, we want to vaccinate people who are at the highest risk first. So this is the priority risk groups, and so these are groups that have been identified as being particularly higher risk. Now, it's a little bit different in that, there's some thought that older folks have been exposed to something a little bit more similar, whereas younger folks may not have. We look at those previous pandemics and sort of going back to the 70s or earlier, elderly people are not, on average, perhaps getting quite as ill as some of these other groups, such as pregnant women. Infants less than 6 months old cannot be vaccinated, and so they clearly are a group that you want to protect their household contacts. Healthcare providers, because we see it all the time, and somebody's got to take care of the sick people. Then kids 6 months, 24 years old, and then between 25 to 64 with chronic medical problems, so COPD, emphysema, diabetes, heart failure, things that cancer, getting treatment, and that sort of thing. Again, kind of a similar, if vaccine supply is limited, the risk groups are these listed here. And those will be the people, again, as the vaccine trickles in, those are going to be the people who are targeted. So, for people in a work environment, and things you can do too to protect yourself are, eat right, get plenty of rest. If you have chronic medical conditions, take care of them. Work with your doctor on that. But again, we want to encourage people, if they're ill, to stay home, wash your hands regularly. My wife is taken to having a bottle of hand sanitizer in her purse, and we decontaminate. I have little kids, and we decontaminate them every chance that we get because they're little germ factories. Encourage people who are at risk to be vaccinated. The vaccine, every year, there's a lot of concern about the H1N1 vaccine being pushed through and being new. And the reality about that is the flu vaccine is new every year. And so the virus in the injectable, in the shot, is dead. And so largely the vaccine that's being produced now is the same stuff with a different virus. And so I feel because of that, it's not a totally new vaccine. I think that we should feel more comfortable perhaps than what some other organizations are, or maybe portraying it as. So just 2 cents, same stuff, different virus is dead. So I would encourage everybody who meets the criteria and is eligible to get one. I'm encouraging all of my patients to get it. I got my own, I lived through it, feel fine. So again, the 3 C's: clean your hands, cover your cough, contain your germs by staying home when ill. This has been everywhere, so just a reminders about that. Again, for people in the work, if you have some hand sanitizer you can carry with you. That way, if you feel like you just have to touch your eye, squirt yourself, get a little there and do that. And then some of this stuff is for employers and things again. And then this is just kind of a good quote. The only thing more difficult than planning would be explaining why you didn't do it. And so that's why we're trying to get out and educate patients, educate the community about what it is, what it isn't, and how do we as a community work together to prevent this from becoming more of a problem than it needs to be. There's a lot of information here. I think that we'll have this available to you if you want to get any other resources or have some more time to look at things on the internet. And then there is a public hotline available, and we'll have that available for you as well. At what point not everybody who gets influenza or gets influenza-like symptoms needs to go to see a physician? And so what are the signs and symptoms that would make you think that, yes, I do need to go? And so that's a great question. And again, the bottom line is if you're not sure, call your physician and talk to them about it because they know you better. Typically, again, if fever is not necessarily, if you're not able to keep anything down, if you're not able to take liquids, if you're not able to, you're getting dehydrated, that sort of thing, obviously you should be seen. If you are feeling more short of breath, if you feel like your symptoms, you look at these symptoms and you feel like your symptoms are out of proportion to that, but if you have a lot of other medical problems, say you're diabetic and all of a sudden, you just cannot control your blood. These are all things that you should be picking up the phone and calling because your physician will know you better. But again, shortness of breath, inability to maintain oral intake, fever that's not controllable, or if one of the other things, influenza can really lead to pneumonia on the back end. And so one of the things that's very problematic is that influenza puts you at more risk to have pneumonia on the back end of it. And so if you have the symptoms of influenza and you feel like you've gotten better, and then all of a sudden you start having a lot more productive cough, you start having a fever again, that's probably a sign that you should get in and be seen. Pneumonia vaccinations are not preventative against all types of pneumonia. And so we're getting a little technical here, but pneumonia after influenza is not always staph pneumonia, but it can be due to staph infection. And so it's more common. Now, the pneumonia shot treats a strep species that we call strep pneumo or strep pneumococcus. It is not good against every strain of that bacteria. It does not prevent against other causes of pneumonia. So you can still get pneumonia despite the pneumonia shot. In general, pneumonia vaccination is recommended for all people over the age of 65. Now, some people under the age of 65, again, this is something you should talk about with, COPD or emphysema or chronic lung disease or other medical conditions that might place them at more increased risk, should talk to their doctor because they may be vaccinated earlier. But in general, if you're healthy, 65 is the general recommendation for that. But you should not, you don't need a pneumonia vaccination now just because you had influenza.